So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease-free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome everybody to another live discussion with Assuaged Foundation, and today we are discussing vitamin D benefits. Go outside and get some sunshine, says Michelle A. Today our student speakers are Aysha, Rahman, Huda, Dawwood, Jennifer Markle-Dumnich, and Cynthia Cherise Murphy, and we want to thank also our slide contributors this week, Jayashree Salian, Shiloh, Touby, Soleil, Zamora, Aysha, Rahman, Madison, Clark, and Katherine, Aybar. For the agenda today, we're going to talk about the importance of vitamin D, sources, functions, and health benefits of vitamin D deficiency, recommended daily intake of vitamins, health risks of excessive vitamin D, testing, prevention, and pregnancy, and then talk about questions for discussion.
What is vitamin D? Vitamin D is a fat-soluble vitamin that is naturally present in some foods such as eggs, fish, and mushrooms. It is produced when the skin is exposed to sunlight. It promotes the absorption of calcium in the bone and phosphorus in the gut. It maintains healthy bones, teeth, and immune system function. Why is vitamin D so important? Maintaining strong bones requires sufficient vitamin D levels. Even minor deficiencies in this crucial nutrient can weaken bones, as the body will prioritize maintaining balance elsewhere by withdrawing calcium from bones. This can result in various bone health conditions, including rickets in infants and children, improper bone development, impairing proper bone development. Adults may also suffer from osteomalacia, commonly known as adult rickets, characterized by bone and muscle pain, or osteoporosis, which involves a loss of bone density and thinning, increasing the risk of fractures. Sources of vitamin D, food sources. Some options include, but are not limited to, mushrooms, raw white exposed to UV light portobello, milk, soy, almond, or oat, ready-to-eat cereal, broccoli, raw, carrots raw, almonds, apples, bananas, brown rice, wheat bread, lentils boiled, sunflower seeds roasted, and edamame shelled and cooked. Sun exposure. Sunlight exposure in moderation. Type B UV exposure, or UVB, can be affected by time of day. Cloud exposure, melanin content, sunscreen SPF 8 or higher, or smog. 5 to 30 minutes daily or twice a week is recommended. Dietary supplements. They can contain vitamin D2 or D3. D2 is manufactured using irradiation, ergosterol, and yeast. An animal-free version of D3 is sourced from lichen. Functions of vitamin D. Vitamin D helps to normalize blood levels of calcium and phosphorus while also absorbing that calcium to make bones strong and stable. When this happens, it also aids in muscular health and growth. Iron can also be absorbed and stored as well. Vitamin D also helps the immune system, keeping it healthy and stabilized. This helps lower blood pressure and prevents inflammation. Vitamin D aids in protecting the body from infections, and cancer growth is reduced. Vitamin D deficiency. Usually, vitamin D intake is decreased over time. Limited exposure to sunlight, kidneys unable to convert 25-OHD to active form, inadequate absorption of vitamin D from the digestive tract. Groups at risk are infants that are breastfed, older adults, people without sufficient sun exposure, darker-skinned people, those with limited fat absorption, and those who have had gastric bypass surgery or obesity.
Health risks from excessive vitamin D intake. Excess amount of vitamin D can be toxic. Vitamin D increases calcium absorption in the gastrointestinal tract, and excess amount of vitamin D can lead to hypercalcemia, a condition in which the calcium levels in blood is above normal. Hypercalcemia can affect kidneys, digestive system, bones and muscles, brain, and heart. Recommended vitamin D intake. Vitamin D can be made while being in the sun due to the body making it into calciferol. This is a vitamin that chemically converted when the UV rays activate the vitamin in the skin. It is important to have a healthy amount of sunlight while it also protecting the skin. It's important to wear sunscreen and prevent burning the skin as well. The body absorbs the sun differently due to climate in different areas, as well as melanin in the skin and the UV index. Due to some people not absorbing enough or having access to the sun, it can be taken and is even a recommended vitamin to take often. Recommended vitamin can be taken 0 to 12 months, 10 micrograms, 1 year to 70 years, 50 micrograms, 71 years, and over 20 micrograms. Vitamin D testing. A vitamin D test is used to screen for low levels of vitamin D in your blood so you can treat it with supplements before it causes health problems. If you have a non-bone disorder or a problem absorbing calcium, a vitamin D test may be used to see if a lack of vitamin D is causing your condition. Your provider may order a vitamin D test if you have osteomalacia, soft bones, often with muscle weaknesses, low bone density, which can lead to osteoporosis, rickets, and problem with the bone growth in children. Because vitamin D can affect many parts of your body, you may have your vitamin D level checked. If you have other chronic medical conditions, ask your provider if you should be tested. How to get tested? A vitamin D test is a blood test. During a blood test, a healthcare professional will take a blood sample from a vein in your arm using a small needle. After the needle is inserted, a small amount of blood will be collected into a test tube or vial. You may feel a little sting when the needle goes in or out. This usually takes less than 5 minutes. You don't need any special preparation for a vitamin D test. There is a very little risk to having a blood test. You may have slight pain or bruising at the spot where the needle was put in, but most symptoms go away quickly. The benefit of vitamin D. Several potential benefits comes with vitamin D includes reducing the risk of diseases like multiple sclerosis and heart disease, healthy bones and teeth, improve brain function, healthy infants, regulates insulin levels, boosting immune health, and preventing cancer and diabetes. Vitamin D2 versus vitamin D3. Vitamin D2 can consume from only plants. Vitamin D3 can consume from sun and meat. Argocalciferol is the chemical name for vitamin D2, and cholecalciferol is the chemical name for vitamin D3. Less effective than D3 at raising blood levels, more effective than D2 at raising blood levels. Vitamin D and pregnancy. A study found that 4,000 IU of vitamin D daily during pregnancy helps prevent preterm labor, birth, and infections. The importance of vitamin D during pregnancy. It is important to get a daily dose of vitamin D during pregnancy as it supports healthy bone development in babies. Most prenatal vitamins only contain 400 IU. Supplementing with additional doses may be necessary to meet the recommended daily intake. Prevention. Consume fatty fish and seafood. Vitamin D supplements. Eat more mushrooms. Include eggworks in your diet. Eat fortified foods like milk, orange juice, tofu, plant-based milk. Try UV lamp. Vegan supplement. Most vitamin D supplements are derived from animals, but a few vegan options are available. Vitamin D2, which is plant derived, is widely available and suitable for vegans. Vegan D3 made from lichens is less common but can be found in specialty health stores or online.
Thank you so much for that wonderful presentation, Aysha and Huda. Um, so we are going to move on to our first set of questions with our student team. Can a vegan diet cause vitamin D deficiency? It is a recognized fact that anyone, regardless of their dietary preferences, being vegan or non vegetarian, can become deficient in vitamin D if they don't include appropriate sources of this vitamin in their diet or if they don't get enough sun exposure. Research indicates that a vegan diet generally provides less vitamin D compared to diets followed by meat eaters or lacto-ovo vegetarians, those who include eggs and dairy products. So let's go ahead and switch the team members on here onto the screen. All right. So what do we think about vitamin D deficiencies? I know there's a lot of controversies around that, and so Aysha, what comes to your mind when you think of that?
Yeah, so for vitamins D deficiency is very common, first of all. And then for the vegan, I do agree with the fact that regardless of dietary preferences, being vegetarian, non-vegetarian, can become a vitamin D deficiency. But getting vitamin D can be very challenging for the people who choose to be vegan because animal food such as milk and eggs are high source of vitamin D. And that therefore they has to be very carefully plan the diet plant-based because keep in mind that vitamin D2 actually comes from the plant-based diet. And then D3 is come from only meat and sun from exposure. So yeah, I don't know. I've never been a vegan, so I always love meat and eggs. So and I don't know how vegan, people who's, being a vegan is nice. It's been vegan lifestyle is very nice, but I don't know if they're getting enough vitamin D supplement into their diet. I can hear you, sorry.
Thank you for sharing. I know myself, I've been vegan. Jenny, you've been vegan, right?
I have.
And
You have not anymore?
I mean, with my pregnancy, I have, done what I needed to do, as many, to protect the interest of my development of my child. So I know with vitamin D deficiency, I go get regular blood work, even when I was a vegan, and I never had any deficiencies come up. I don't go out in the sun that much, to be honest. I burn so easily. Um, Jenny, what are your kind of emphasis around that?
Yeah, I've oftentimes when I've had blood work done, I have had vitamin D deficiency. So I have for years taken a vitamin D supplement. During the summer months here, I go out in the sun quite often, but obviously not as much in the winter. So I'm, listening to my body quite frequently. And as we get into the winter months where I'm not outside as often, I'll increase my intake, through supplementation just to make sure, because what I notice is, more mood impacts from it, where I get very down and kind of depressed and cranky and those sorts of things is what I notice. And if I increase my vitamin D supplementation, that goes away.
Absolutely. Huda, do you have any thoughts to weigh in on, my dear?
Sure. I definitely do think that anyone can be vitamin D deficient, whether you're a vegan or not. For example, me personally, I'm not a vegan, but vitamin D deficiency is something that comes up in my blood work a lot. And my doctors always recommend for me to take supplements. So it's not something like the deficiency isn't something that's only, you know, an issue for vegans. Anyone can get it. For me personally, I think it's more so about avoiding the sun. So I try to like incorporate more vitamin D into my diet, with like seafood and then trying fortified cereals and stuff like that. But I definitely do think that this deficiency is something that can come up in anyone, regardless of what your diet is.
Absolutely. I could not agree more with that. Do it works for you. And yeah, all right. So let's go ahead and dive into the next question here. So that was the first one. Second one, what is the reason for including vitamin K in your supplements? Vitamin D and vitamin K are closely interconnected nutrients. While vitamin D aids in calcium absorption, vitamin K plays a crucial role in ensuring that the calcium is obtained from both food and supplements, effectively utilized for bone health. That's an interesting fact. Um, so, what do we have to weigh in on that, team?
I think that's very interesting. I feel like I've heard this before, but I will say that I do not currently take a vitamin K supplement, and I don't think it's in any of the supplements I'm taking. However, I do believe that there's a ton of vitamin K in like dark leafy greens like kale and those sorts of things. And I eat a lot of those. So hopefully I'm getting enough to make that difference.
Yeah, absolutely. And how I mentioned earlier with being vegan and not necessarily doing the vegan diet during pregnancy, I'm definitely going back once I give birth. One of my big things has been calcium deficiencies because I was born with a bone disease. I was born without any bones in my face. So I've had over 16 reconstructive plastic surgeries, and breastfeeding is even a big concern for me, as that's the main point of the birthing cycle where your body depletes calcium. I've been going and getting regular checkups and testing, and my calcium levels are great. I'm not eating meat. Been mainly just doing vegetarian, until going back to, I like to do a lot of raw juicing, kale, and just all those amazing vegetables that have rich sources of vitamin K and vitamin D. So I think it's just important to see what works for you and to do that due diligence through, blood testing, monitoring. You just have to make the request with your doctors. They won't tell you this, but when you go to see a doctor, you literally have to say, I want to get my vitamin levels checked. Many people don't know that you can ask that of your doctors, and they'll go and, pay all this money to get outside testing. So.
Yeah.
What do you think, Aysha?
Well, that's true. I think vitamin D is another additional health benefits, you know. So I never get checked in for vitamin K. That's, I probably will, my next appointment, I'll ask. So, yeah, so this is interesting fact. It's good to know. Yeah.
Thank you. Huda? Huda?
Yeah, I agree with everyone. It is really interesting to see the different types of vitamins and how they work together, which ones work better in conjunction, which ones you shouldn't take together. And I know, Cynthia, you were mentioning a calcium deficiency, and when I was looking at supplements, because again, vitamin D deficiency is like something I deal with a lot, I noticed that like a lot of supplements will have not just vitamin D, but they'll have like vitamin D and vitamin K, and then also for calcium, these like calcium gummies I was looking at had vitamin D in them as well. So a lot of the time, supplements I think will pair those together because they know that'll help in the absorption of one or the other, which is like they're not advertising it. But I do think like it's well known for the people who are making the supplements, maybe not the people who are taking them.
Absolutely. Thank you so much for sharing. All right, so we have two more questions. We're going on the third one here. Are there any medication interactions with vitamin D? Vitamin D is generally regarded as a safe supplement, and the dosages included in our products are not associated with any reported adverse interactions with prescription medications. Nevertheless, if you are currently on medication, it is essential to keep your primary care provider informed about the supplement you are using. Great input. Food for thought.
Yeah, I don't take any medications, as you know, Cynthia, so I generally don't think about this too much, but I've never heard anybody in all the people that we've worked with that have ever had an interaction with vitamin D, but I do know that vitamin K acts as a blood thinner. And so oftentimes, if you are taking a supplement with vitamin K, if you're having any sort of procedure or surgery done, doctors will tell you to stop taking that for a period of time before having anything done.
Oh, I did not know that.
Yeah.
Wow.
Yeah, because one of the supplements that I actually used to work with had vitamin K in it, and people would have to stop taking it for a couple of weeks before they had procedures done. I mean, whether they really needed to or not, I don't know. I'm not a doctor, but they advised them to stop taking it. So since we were just talking about vitamin K in the last slide, I thought I would throw that in there.
I love it. Well, I learned something. Thank you for sharing.
Mm-hmm. So don't go out and start taking vitamin K before you have your baby.
Yeah, I know. I've been so cautious on supplements anyways. I haven't really been messing with anything, no prescriptions, no supplements. So yeah, I definitely that's food for thought on that one.
Mm-hmm.
Aysha, what do you think, my dear?
Yes, so it's good to know that it has vitamin D. Taking supplement vitamin D is safe. But according to medical expert, I heard that if you're taking a steroid drugs, it can interfere with the vitamin D. And if you're taking it daily, then you have to speak to the doctor whether you can take the vitamin D. So these are the only drugs can interfere with that.
And what type of medicine was that, Aysha?
I think it's for, like you said, blood, something.
Oh,
it's called steroid.
Oh, okay.
I think it's
Gotcha.
oral steroid, not the ointment or anything. It's
Okay.
something you take orally. Yeah.
Okay.
Thank you for sharing. Huda, do you have anything to weigh in on, my dear?
I also don't really take any medications, just like supplements here or there. So I also haven't heard of anything personally where you shouldn't take a supplement with something, but that is interesting to hear about the vitamin K being a blood thinner. And I guess it's one of those things that we can do a lot of our own research and we should, but in the end, I always think it's best practice to consult with your doctor first before doing anything, just because they're the experts and they know a lot more than we do.
Absolutely. And we actually had a student chime in the chat, Ali Husky. She said vitamin A, D, E, and K are fat soluble vitamins, which means that they dissolve easier in fats. Always thought that was cool. That is cool. really.
And they
very-
also, because of that, I'll add something, Cynthia. They are the only vitamins that you actually can overdose on and have a side effect because your body can't basically pee it out. If you take all the other vitamins are water soluble, and if you take too much, you'll just pee it out. Generally speaking, I'm sure there must be some level you could overdose on, but generally speaking, your body will just clear what it doesn't need. But because these are fat soluble and they're stored in the fat in our body, you can overdose on them way more easily.
Wow, that's scary.
Mm-hmm.
Well,
and you'll also notice that most fat-soluble vitamins, so the AEDK, will say on them that they're best taken with food, and that's because most of the foods we eat also has additional fat, so it gets absorbed easier in the body.
Wow. You guys are just like an encyclopedia of knowledge. I love it.
All
Okay,
right.
so I think we have one more question.
Yes, we do. There you go.
Can I obtain all of my vitamin D solely from food sources? Vitamin D is present in limited quantities in certain foods, and relying solely on a diet can make it challenging to achieve adequate levels. To fulfill the recommended intake of 10 micrograms of vitamin D, you would need to consume the equivalent of 6 eggs, 4 tins of sardines, ew, approximately 4 bowls of cornflakes, 10 UV treated mushrooms every day, whatever suits the way that you get your vitamin D. I have no judgment towards that. Yeah, food for thought.
Not 6 eggs a day.
Or the sardines. Like, that's not gonna happen.
And I don't like the mushrooms, so I think I'm going to have to pass on all of those and take my supplement.
You live by mushroom. You know, it's so funny. I always tell because I love mushrooms, and Jenny, we've been all over the United States traveling for business events, and I'm always trying to get her to try like vegan mushroom dishes. And she's like, Cynthia, I don't know how to tell you. I hate mushrooms. Why are you?
But I have tried them a lot. I've tried them for you, and I've ended up spitting them out most of the time.
Yes.
And so the funny part of it is, so you all know, I live in the mushroom capital of the world, where 60% of the world's mushrooms are grown right here in the town where I live. So I smell mushroom farms all the time, and I don't even get the benefit of liking to eat what they produce.
Yeah, that's it. But mushrooms, I believe, are saving the world. And I know there's so many supplements. I actually just ordered a coffee with all these mushroom blends in it. So I'm curious to see.
I do like that, Cynthia. I drink mushroom coffee every morning.
Okay. All right. Well, there's got to be something in there.
They've finally converted mushrooms into something I can consume.
Yeah. I love it. Aysha, what do you think, my dear?
No, I was just saying that no, 6 eggs, no, impossible. I'd rather take the vitamin D supplement.
Like no eggs. I'm like no sardines. Jenny's like no mushrooms.
Yeah.
Yeah. People say you just go out in the sun and get it, but I feel like when I go out in the sun, like you could see, I went out in the sun yesterday and I'm red, and all I had to be 3 minutes, and I just get burned.
Yeah, I would love to get, but it's impossible going out every day, getting the sun exposure. No, it's not. But like I said, like vitamin D we just read that it's safe. Yeah, we can take it, and this is our doctor prescribe if we have that vitamin deficiency. They don't say that, okay, you have to eat those food. They don't say that. Just say, okay, go to over the counter, and get some vitamin C supplement. So yeah, I'll stick to that.
I love it. Huda, what do you think, my dear?
I think taking one supplement a day is way easier than trying to eat 6 eggs or 10 mushrooms or any of that. It just puts into perspective like how much you would have to eat if it was just solely based on your diet. And like you mentioned, Cynthia and Aysha, like going out in the sun, yes, it's a source of vitamin D, but it's not always the most practical. And then you also have to worry about like maybe skin cancer or sunburns and stuff like that. So it's a fine balance that you have to work with.
Absolutely. And I know with mushrooms, like I love mushrooms, but I know they get really dirty, and like when I'm sitting there cleaning like some of the mushrooms and all that dirt comes off, I'm thinking in my head, is that taking away the vitamin D? Like, are you supposed to leave a little bit of that dirt on there for that?
I don't know, and I'm fascinated by this terminology here, UV treated mushrooms, because when I think about the mushroom farms, they grow them in the dark, right? So I'm curious now, are all mushrooms at some point UV treated, or are only certain mushrooms UV treated? And I don't have that answer either. But I'm curious. I'm going to look it up after the call for sure.
Absolutely. Because, natural light versus UV light, what is the equivalent? Is that equivalent to the generated vitamin D that you would get from most?
And maybe there's a certain stage of the growing process that they treat it with UV light, because if the mushroom farms are all these very enclosed buildings, they have no windows, nothing. So they just have solid doors that go in, that the workers go in through, but they're very dark inside. There's no sunlight that gets in. And so I'm just curious, because you can't see inside to know what's happening in there. So I don't know if there is a process that they treat them at some point with that, or if that's only certain types of mushrooms that they do that for. So I'll be curious to learn after the call.
Absolutely. Well, this was certainly an enlightening presentation that you guys put together. And as always, thank you guys for just being amazing and putting your heart and soul into these presentations to educate the public. Jenny, thank you for always spearheading our presentations. And Aysha, you've been leading, putting them together with team members. All of you are so valuable. We thank you so much. Huda, thank you for being here. Ali and many other students were on the call today. So yeah, we're going to go ahead and close this out for today. We will see you next time. Thank you for joining our student team.
Thank you.
Bye.
Bye. Thank you.
Thanks. Bye.